Hello, good morning, everybody. It's my pleasure to introduce to you a really good friend at this next episode of Practice Pulse podcast. My name is Dr. Aditi Agarwal. I'm a general dentist and also co-founder of Practice by Numbers. I have with me today Dr. Eric Block, who is a full-time practicing dentist in Acton, Massachusetts, who also owns Acton Dental Associates. Say hello, Dr. Block.
Hey, thanks for having me. Pleasure to be here.
Thank you. Thank you for taking the time out of your busy day to share your story with us. A little bit about Dr. Block. He graduated from the Nova Southeastern College of Dental Medicine in 2002 and completed a 2-year implantology residency at Boston University in 2004, also my alma mater. He is certified by the American Association of Dental for Continuing Education. He's the co-founder of the International Academy of Dental Life Coaches. He is a wellness ambassador to the ADA and the former chairman of the Massachusetts Dental Society Health and Wellness Committee. He hosts the Stress Free Dentist podcast show and Facebook group. He also hosts the Massachusetts Dental Society podcast, The Fourth Molar Beyond Wisdom. He is the author of a series of nonfiction and children's books, all of which that can be found on Amazon. He can be Take it away, Dr. Block. How are you this morning?
I'm doing great. Yeah, thanks for the introduction. And it's been, really a pleasure to get to know you. And over the last, few years, even though we went to BU together, that was a while ago. And I love just what you're doing and how you're helping dentists. You have such a great software, and I love this new podcast that you're doing. So congrats on everything that you're doing.
Oh, thank you. I really appreciate it. It means a lot to me coming from you. So tell me one thing. How did you decide to become a dentist?
I actually went to Tulane University in New Orleans, and I'm actually originally from Andover, Massachusetts. And I went to Tulane thinking I was going to be in the business school and applying to the business school. And I took microeconomics and macroeconomics and statistics. And I was just like, you know what? This isn't for me. I don't really enjoy these classes. And I don't think I'm going to apply to the business school. So I had to choose something. So I ended up choosing psychology, and I actually graduated with a degree in psychology. But my junior year, I just missed my mouth one night at a bar, and I broke my number nine central incisor,
Oh,
and
wow.
I just cracked it in half. And I went to a local dentist the next day, and I just loved the way they took care of me and patched me up. And I walked in all embarrassed, and I left with my smile again. And I was like, you know what? I could do this. This is something I could do. So I took all the prereq classes. There was actually no major for pre-dental or pre-medical at Tulane. So I finished psychology. So I took a lot of the pre-dental classes over the summer, and I actually took a year off after college to teach tennis and take the DATs. And I'm like, you know what? This is something I could do. So I applied to dental school. I got into Nova Southeastern. I went there in Fort Lauderdale. I was actually the second class to graduate in '02. And then from there, I said, you know what? I'm not ready to go into real world dentistry yet. So that's when I went to BU and did the implant program. So that brought me back to Massachusetts, and I've been practicing here in Acton, Massachusetts, which is about 30 minutes west of Boston, for about 20 years.
I know, right? Time flies when you're having fun, as they say.
Yeah, sure does.
Wow, that's an amazing story. Did it that you came full circle back home, or very close to home, to build your life. So that's pretty amazing. It's funny how all of us take these circuitous roads, these journeys, and then come back to the beginning or come back to roots. So that's pretty awesome. So tell me a little bit more about the books and why you wrote.
Yeah, about halfway through my career, I went through a tremendous amount of burnout, and I actually regretted my decision in dentistry. I was extremely full of anxiety and stress, and I didn't enjoy going into work. I I couldn't wait until I could go home at 5 o'clock. I couldn't wait until the weekends. I dreaded going into work on Monday. I'd have a major Sunday night blues. I really was full of anxiety, and to the point where I couldn't get the thought of possibly being sued out of my head, that I actually thought about leaving dentistry and going to law school so that I could be the one doing the suing. That's how in my head I was about being sued or getting a bad review or having an uncomfortable conversation with a patient or a staff member. And like I said, I graduated with a degree in psychology. So I always knew that at some point in my life, I would go through therapy. And I had hit the point where I hated dentistry. And I'm like, you know what? I'm in a lot of debt. This is no way to live. I dreaded going into work. So I knew I had to do something. So I finally picked up the phone and I called a local therapist and started going through therapy. And we just dug into why I was so anxious and so full of stress. And it was up here. It was me putting too much pressure on myself. It was me trying to be a perfectionist and me focusing in on the one or two bad things that would happen in the week and not all the good things that would happen. And I really got back to the point where now I love going into work every day. And I wrote a book called The Stress Free Dentist, and it was just me sharing my story about how I overcame burnout. And I just wanted to share that story with other dentists that may be going through the same thing that I was going through, and to kind of prove to the point that you have to do something if you're feeling these negative feelings towards the profession. It is not an easy profession, for sure, that we chose, but you only live one life. You only get one mind, you only get one body, and you want to enjoy going into work. And that's where the book came from, the podcast, the whole stress-free brand. It really came from me just wanting to share my story.
That's amazing. And what a beautiful story you have because as you and I both know, our career choice has led us through many, many different paths of, even entrepreneurship, owning a business. None of us went to school for that. And there are a lot of challenges that come with running and owning a business and doing the work in the business and overseeing everything else. You're one day you are the HR manager, the other day you're the janitor, third day you're the IT person. It's like, how many hats can one person wear and wear them all well to make sure that everything is running smoothly? And I feel like there is a lot of pressure. Everybody handles it differently. But the fact is that you chose to share the fact that this pressure is real. This pressure is okay to have. And the fact is that um, more than one person at one time is experiencing this pressure, and how to reach out to people, how to connect with people in our profession, and talk to them about what is going on in your professional lives. You know, dentisting is a very isolating profession. I know it, you know it. We've both been dentists since 2002, three, when the internet was not a thing. And we were, especially if you opened up businesses early on, we were kind of, it was a quiet, oh, how do you say, understanding that the dentist down the road is your competition, that
Mhm.
you can't be talking to them. And that has unfortunately created a lot of stress within us because we're all competing for the same patient pool. And, all that added on to running a business or trying to figure out how to run a business is extremely stressful. So I'm so, so glad that you were able to put in words what a lot of us are feeling. So having a psychology background really helped, I'd say.
It did. And, I didn't really, I think that if I didn't have that psychology background, maybe I wouldn't have picked up that phone. And who knows, maybe it could have led to, down a dark path where unfortunately a lot of dentistry and a lot of dentists end up down a dark path with depression, anxiety. You've heard the statistics with suicide, substance abuse, you name it, it can happen if you're not careful.
Yep.
And yeah, I feel like I should have done therapy years and years ago. In fact, I'll always have a coach, a life coach, or a therapist, and I'll continue to do it probably throughout my whole life. We go to the gym and we exercise our muscles and our biceps, and I feel like going to therapy is like exercising your brain. So, and you only get one brain, so take care of it while you're on this earth.
That's true. That is so true. Otherwise, what can you leave as a legacy to pass on, right? Besides stress and your children, your family, they witness all that you're going through, and it's then you're basically in this little storm that you've created, like a downward spiral, and you just keep sinking deeper and deeper. And I'm so glad that you were able to find that line, the rope to pull yourself slowly out of it. And that's the message that I want to send to other dentists out there. And I think we both want to send that is that there is a line, you know, that if you are drowning, you don't have to go it alone, right? Talk to somebody. And you guys, you have a committee, right? You have an academy of dental
Mhm.
life coaches, which is pretty amazing. And I know some of the members on there, or the board members. You guys are doing such amazing things. Can you tell us a little bit about that?
Yeah, I wanted a place for dental professionals to go where, like I said, I knew I wanted to go through therapy, but maybe there's a dental professional out there that doesn't know where to go or reach out. So we wanted to create a place for dentists, for hygienists, for assistants, anyone in the office managers, anyone in the dental field to be able to reach out to a life coach. And I feel like, we tell our patients to, take care of that cavity. If you don't take care of that cavity, that problem is going to get bigger and it's going to turn into a crown. If you don't take care of that crown, it's going to turn into a root canal. That root canal may turn into a crack. You may end up needing that tooth extracted. These problems compound. And just like our mental health, if you're having a problem and you just let it go and you just say to yourself that this will get better on its own, it's probably not. And these problems compound and they just get worse. So, to all the dental professionals out there that are listening, if you feel like something's not right, or you feel like you're doing well, but you just want to get to that next level, that's where a life coach can really come in and help. And I really like to focus in on removing negativity from my life. And in doing that, I've been so much more productive with having a therapist and a life coach. I just remove a lot of the garbage in my head and I'm able to be just focusing on positives. And when you do that and you keep positive people around you, and you have some professional coaching, it's really freeing, and you can really get back to enjoying life, enjoying the profession, or just get to that next level.
Right, right. And then would you say that a life coach and a business coach are different or the same, or could you think most dentisting humans would need some time with both, you know? What are your thoughts on that?
I love the word coach, whether it's a business coach, you have a life coach. Tom Brady had a throwing coach. He was the best quarterback to ever live, and he had a coach just for throwing. And that was not to get 1% better. That was to get 0.01% better. So, a life coach will help you figure out uh, kind of solutions to the problems that you're having, and usually it's within you. It's all about asking the right questions and getting some guidance and working through some problems that you may have. Therapy was very different. Therapy, we went deep into my childhood, and um, it was a whole kind of different strategy. But a life coach can really help you, with your life, and in doing that, it will help you with your business. However, I also am very high on having consultants and business coaches as well that can get more into the X's and O's and help with what you're doing as well with your all the help with your business analytics, with practice by numbers, and really get into helping you with your business. And like you said, we didn't learn any of this in dental school. And I don't blame the schools. I was so focused on just finishing my clinical requirements and graduating that I feel like if they had extra classes on business, I probably wouldn't have paid that much attention. I would have been like, this is, just another class I have to do, because I just wanted to get out of there. I wanted to graduate and pass my national boards and uh, get past my licensing exam. So I actually don't blame the dental schools for our lack of business training.
Right. Yeah, no, I mean, I think there was so much on our plate already, and we were so focused on just getting good at teeth that,
Hmm.
probably adding on the business coaching would have just fallen flat, or because there would have been no context. And I think it's more when you get into the trenches and you get context, that's when you just understand that, oh, shoot, I need to do something about this, that I need to learn something about this. But yeah, you're kind of right about that, adding those. But nowadays, again, saying that, considering us being out of dental school for 20 years and the access that the coming students have to a lot of different situations with the internet. And I think it's a little bit easier. And also that there are a lot more solutions that are available on the fingertips than there were at our time. So definitely using resources, using tools, listening to people like you and me who've been through the trenches, so to speak, I think that would be very beneficial for a lot of the new dentists coming out and saying, hey, guys, there are things out there that you can look into that can help you not make the mistakes we did, not and reduce the chances of actually feeling that burnout, getting to that stage of burnout, if we use the resources that are around us, right? Um,
Yeah, and dentistry is an extremely complex profession, and that was another reason why we started the International Academy of Dental Life Coaches, is that our coaches understand dentistry, whereas personally, my therapist, when I was first struggling with my burnout, did not know anything about dentistry. They were just a local therapist, and I would go through these long explanations of the dealing with patients and the staff and all the intricacies of the dental industry, and she would just have no idea what we go through. So we kind of get each other, we walk in each other's shoes, we live these parallel lives. Dentists get each other. And you're right, it's when you get out and you get a few years under your belt and you are in the trenches, then you really can put into context, um, with the help of a business coach or a life coach. But it's really hard to simulate that unless you've actually been out there and practicing.
Yep, absolutely, absolutely. What keeps you passionate about dentistry, Eric?
I love technology. I love adding new treatments. I love adding new techniques. It's kept me fresh. So for example, we got a 3D printer in 2021. In 2022, I added clear aligners. In 2023, I added sleep and airway.
Mhm.
This past year, I added same day milling. So all these things that I add just keep me re-energized in going into work every day. and I look forward to doing same day crowns. I look forward to doing clear liners. It's it if you get stuck in that hamster wheel of dentistry of just doing the same old thing over and over and over again, then you can get caught up in burnout. I just want to keep reinventing myself and adding new things and keeping things fresh. And I love it, and my patients can sense that.
Mhm.
And it's such a great way to, keep yourself re-energized with this profession.
And what would you tell people, of course, change energizes you, right? But I'm sure there are a lot of dentists who say, okay, I got through dental school. I opened my practice. I don't want to put in the time, energy, and effort right now to do these procedures, to do more CE. What would you say to them who want to just keep being on that hamster wheel, because they're scared, right? Um, a lot of, and we've all been there, right? Whenever you add a new technology, you're always concerned and scared. Oh my gosh, is my staff gonna accept it? Are my patients gonna accept it? What do you, what have you noticed and what have you witnessed and felt, and how have you handled that?
Yeah, I actually wrote about this, and I call it the duality of dentistry, where there's the clinical side and then there's the non-clinical side. With the clinical side, we have to be very slow and strategic because we're working on patients, and what we do is very intricate. So when I add a new treatment modality, that's a big deal, and I want to do it slowly and strategically. I want to onboard the staff. I want to make sure that clinically I'm staying in my comfort zone, that I'm not, let's say I'm adding implants to my practice. You don't want to do an all-on X for your first case or a central incisor. You want to do this very very slowly for the best interest of yourself and your patients. Now, on the flip side, there's the non-clinical side of dentistry, and I think it's the opposite. I say go fast and quick and try things, and if it doesn't work out, then pivot and change. Add a new software. Try something new with a new technology. If it doesn't work out, then you tried and you move on. Um, and I think fear is a major factor. We fear change. Ourselves, we feel fear change. We've been doing something the same way over and over, but that's what leads to burnout. And when you change things and you add something new, it becomes addictive and it opens up this whole new world of dentistry. For example, I we started scanning. I was very hesitant and scared to go from impressions to scanning. Now I look back and I'm like, why didn't I do this earlier? I love doing crowns so much more than when I was doing traditional impressions. I look back and I'm like, I was so scared to get into sleep and airway, and now I love doing it. If fear takes over your brain, then it's gonna make for a long career. So I say you got to lose that fear. When it comes to clinical, be slow and strategic. When it's non-clinical, go fast and quick.
That's awesome. That's a great piece of advice because, change is hard for everybody. And, splitting it and dividing your attention, saying, okay, this is what I'm going to do clinically and this is what I'm going to do non-clinically is always a great thing. And, you know, there is always going to be pushback from the team because teams hate change and they feel your vibrations, right? As they say, because you're skeptical about change, but you want to do it, but you're not sure, and they can sense that. And so it's really important to communicate with your teams that in order for growth, change is important, right? And but then you are the deciding factor on how to execute that change and how to deliver the change and how to even plan the change. Um, and you just need to have your team on board 100%. That requires conversations. right? Conversations with team members, which can be daunting, right? Because you're like at the end of your long day of practicing dentistry, you're like, well, I really, in your mind, you're like, I really want to make this change, but how do I get this person on board, right? And that is an exhausting conversation as well. And that's when your stress level goes up because you're like, oh, I'm dreading having this conversation because I know I'm going to get pushback. And how do you deal with that? Like with teams,
Yeah,
with
when I
this
when
big
I
change.
when I first became an owner, I was like shot out of a cannon, and I wanted to make all these changes and add new things and change systems, and that was not the way to go about it. And I got tremendous amount of pushback. So now I really pump the brakes when it comes to a change. Now, if it's a change in my technique, when I'm doing, let's say, back-to-back class two composites or something like that, that's a different story. That's something that's more with me and my system, the materials. But if it's something big, then I love the morning huddle for something like that, and I'll just mention it, little leave little breadcrumbs, sometimes every day. Um, and the more, if you just do this major change, you're going to get major pushback because it's something new for the staff. They may fear the new because they may think that means more hard work.
Mhm.
And staff just wants to most of the time continue on what they're doing. That's what they're comfortable doing. They're in their comfort zone. So I love the morning huddle to add something new and talk about it. And it doesn't have to take long, but I slowly build on it. And then I constantly onboarding the team and constantly communicating with them. So it's not like this big surprise when we add something new.
Yeah, yeah. No, that's really important. I think giving it in bite-sized nuggets, as you said, and really talking about it. And I think you have to plan for it. Especially with change, you have to tell your staff slowly, maybe even 3 months before you want to introduce the change that, it's coming, it's coming, it's coming, and then slowly what is it that's coming and then you implement the change. I think
Hmm.
that way you get the best results without the additional stress
Hmm.
and the major pushback. So I totally agree with you. Bite-sized nuggets for teams is great. Um, so what message do you hope to convey to dentists that are experiencing burnout?
Yeah, there's nothing wrong with you. I thought there was something seriously wrong with me, and it was the way I'm wired is I'm a bit more introverted. Even though I have podcasts and I do speeches and have webinars and do all those things, I actually really like to decompress by just being quiet.
Mhm.
And the social aspect of the profession was really draining on me. And it was the going from room to room to room and working on a patient and giving them the best possible experience I could give them, and then popping into the hygiene room and still having that, that happy face on. And to me, it was exhausting. By the end of the day, I was just totally wiped. And I'm like, what is wrong with me?
Yeah.
But the fact of the matter is, there's nothing wrong with me. And a lot of dentists I know share the same feelings. This profession is hard. It's a hard profession that we chose. It's a marathon, not a sprint. There's going to be good days. There's going to be bad days. There's going to be fillings that fall out, crowns that don't fit. There's going to be bad reviews. There's
Mhm.
going to be uncomfortable conversations. Um, but my mantra is that there's going to be tremendous amounts of stress, but the stress won't break me. That I'm going to live to another day, and I'm going to try to have a better day tomorrow.
Yeah.
And to understand that, guess who else has had a bad review or had a crown that didn't fit or had uh, a patient that was mad at them? Every other dentist in the history of dentistry in the world. So my message is don't beat yourself up, don't put too much pressure on yourself, and reach out for help, whether it's a consultant, a coach, a mentor, a peer. Um, do it the sooner the better.
Yes, definitely talk to people,
Hmm.
right? That is the thing. we are, as you said, introverted. And on top of that, we have all these dentists and all the people around us that we think are competition. But, if there are now societies, there are now associations to help dentists to understand that these things are normal. And you cannot, no profession requires anybody to practice in isolation, to work in isolation. Even surgeons have teams with them, right? We're probably the only surgeons without a big team with us. And even all the people in the tech industry, they work in teams. Um, Again, it's a very isolating profession. Changing though, with the coming with of
Hmm.
DSOs and things like that, it is changing definitely. But even a single practice owner can does not have to work like that, because medicine, dentistry, it's a holistic profession. And we have carved out a niche for ourselves called the mouth, you know. But the mouth is connected, as we all know, to all the rest of us. And more with the understanding of the sciences with airway, we are now getting more and more connected with the MDs, even reaching out to the MDs. I mean, it really opens up your view to see our profession in a holistic manner. And you can actually do better treatment and get better outcomes if you realize that it's not in millimeters. The answer is always not in millimeters. That's what I think. That's the viewpoint that I have gained after doing this for so many years and really understanding what is it that we're doing, right? Why are we doing this? What is the connection? Where did we lose the connection between the mouth and everything else in our body, right? It's the gateway, and we're the protectors. So we have a really, really important job, but that doesn't mean we need to protect it alone,
Hmm.
right? That's
Yeah, very well said.
so I definitely agree with you that protectors need an army behind them. And your peers, your mentors, like you said, coaches, those are part of that army. So reach out, absolutely reach out, don't burn out, because we do need gatekeepers.
Hmm.
We need people in this industry. There are lots, millions of Americans that are going without dental care every day, right? And we need to be available emotionally, mentally, physically to treat them, but we can't do it alone,
Hmm.
right? So, what advice would you like to give to dental professionals? And tell me a little bit about your podcast, actually.
Yeah, so it's called the Stress Free Dentist Podcast Show, and you can find it on Apple or Spotify or all the major platforms. Also, my website, thestressfreedentist.com. You can find out more information about my books and my upcoming events. And I think that, and also you can reach me. I'm an open book. If anyone wants to reach me at Eric at thestressfreedentist.com, if you have any questions, please reach out for sure. And to any of the young dentists out there, um, you can always reach out to me. But yeah, I would say reach out for help. Take classes. I used to take so many classes on clinical and implants, and I wish that I had gone back and took more classes on leadership, business side of things, case presentation, how to talk to people, communication, that type of thing. So, sure, you got to get your speed up and your clinical skills, super important. but don't forget about, we're leaders. Even if you're an associate dentist, you're a leader in that office. Get help, take classes on leadership. And you're right, there's so many resources at our fingertips with Facebook groups and YouTube. There's so many options out there. So get yourself educated, and reach out to your peers.
Absolutely. Well, thank you, Eric. It was such a pleasure chatting with you this morning and, getting the message out there to our fellow dentists and teams and letting them know that they are not alone and what they're feeling is normal. Burnout is normal, and you're going to experience it at some point in your life. It's just we're trying to reduce the intensity of that and say that, hey, you have a friend. And sometimes you just need to phone a friend. So thank you once again for giving us your sharing your wisdom at the Practice Pulse podcast. It was wonderful talking to you today.
That was a pleasure. Thank you.
Thanks.